about these three terms, right? IPC, CRPC and IEA. Now this has been replaced by BNS, BLSS and PSA. Okay, you should know these terms by now. What about these terms? Is there any difference between all these terms? Injury, violence, assault, abuse, harm, trauma, wound, hurt, battery. I think you know about these terms. This is new for you, right? Battery. Okay. Now all these terms looks almost same. Okay, but with a bit difference. Injury is defined. I think this was taken by sir in the introductory class of injuries. Taken or not? All these definitions you'll get in book. Okay, what do you mean by injury? Any harm, whatever illegally caused to a person in body, mind, reputation, or property. Did you get this definition in book? Any harm, whatever illegally caused to a person in body, mind, reputation, or property. If you are using the old book, there you will see that this is defined in section 44 IPC. But as per BNS, it is section 2, subsection 14 of BNS. Right? Now, I'll take, HOD sir is supposed to take this part. This definition, each word is important. Okay? Any harm. So, what do you mean by harm? Number one. Whatever illegally caused to a person, it has to be illegal. Caused to a person. Okay, third point is to a person. It's not to an animal or any other object. So, harm illegally person in his or her body, mind, reputation or property. We as forensic medicine, we are concerned with body. Okay, not with mind, property or reputation. We are concerned with body, but you have to know this definition. Now, say for example, someone is drunk. Okay, and he fell down from stairs and he's having a fracture. That is also injury. But that is not caused illegally. So that is not a medical legal case. So that one has to be illegally caused to a person in body, mind, reputation or property. And that is defined in section 2, subsection 14 BNS. Okay. I'll not go into details. These things HOD sir is supposed to take. This one, hurt. In forensic, you must remember at least these two definitions, injury and hurt, because these are defined in BNS. This one. You cannot change a single word. Other definitions you will get differently in different books. Okay, but injury and hurt, it will be same in all the books because it is defined by law. Bodily pain, disease or infirmity caused to a person is known as hurt. It was in 319 IPC, now it is 114 BNS. Clear? Now what is battery? This is something new for you. Battery is criminal offense whereby a person takes unlawful physical contact with another. I slap someone, physical contact. That becomes a battery. You have subsequently you will know this term as battered wife. Battered wife means who is physically abused by in-laws or husband or someone. So from there you get this term battery. Battered child, battered baby syndrome. You have heard this term? Battered baby syndrome? Not yet. Battered baby syndrome means a baby who is subjected to physical abuse. So battery is this one, a criminal offense whereby a person makes unlawful physical contact with another one. Clear? So you should know these two definitions at least, injury and hurt, because these are defined in BNS, in forensic. Now this one, was it taken in theory? This classification? It is there in your book also. Injuries can be classified in various ways. Medical classification, legal and medico-legal. Medical is when you will talk among yourself. That is a medical classification. Legal is something which the court use. The court will see whether this is simple injury or grievous injury. If it is simple, then punishment, the one which has caused punishment will be less. If it is grievous, punishment will be more. And medico legal, like when you are posted in hospital, definitely you will get injury cases, right? So you have to examine the injuries and you have to write some terms. That will be under medico legal classification. Legal is hurt or grievous hurt. Court will say this, whether the injury which the person has caused to another person, is it a simple injury, section 114 BNS, or it is something serious. Something serious will be grievous. Grievous, it's a long question, I'll come into that in the subsequent classes. So for grievous, the punishment will be more. Okay, so this is the legal classification. Medico legal, whether it is suicidal, homicidal, accidental, self-inflicted, defense, iatrogenic, this will be medico legal. Okay, iatrogenic means what? Yes? Sorry? Louder. Drug induced, okay. Any other? Bolo? Iatrogenic means? Any example of iatrogenic injury? Suppose I got a dead body for autopsy, and I have found multiple needle marks on the body. What will be my thought process? Either he is a drug abuser, or he might be admitted in hospital and injections, these medicines were given. So needle mark doesn't mean that the person is a drug abuse. It may be given in hospital also. Of course, the location depends. So those needle marks which are given in hospital, this will not fall under all these things. These are given for therapeutic purpose. That is an example of iatrogenic. Right? Okay. Medical classification. This is what is there in your book, all these chapters. Medical classification. First, you will know about mechanical injuries, a big chapter of mechanical injuries. Then you have thermal injuries. Then you have chemical injuries. Then you have injuries caused by physical agents. All these injuries chapters are broadly classified into these headings. In mechanical, you have due to blunt force, due to sharp force, due to piercing object, and due to firearms. In the last few classes, this were taken, right? What are those injuries caused by blunt force, that is blunt object, by sharp force, and by piercing object? Today I was supposed to start this one. So you know about the weapons. You know what are the injuries those weapons can cause. Now I have one favorite question. Give me the name of any one object which cannot be used as a weapon. Anything which comes to your mind which you cannot use to cause injury to a person or harm someone. एक एक करके बोलो. Sponge. Okay. Then what comes to your mind? Yes? Cotton ball. Okay. Then yes? Louder. Thread. Okay. Then paper. Then see, I have asked you that you cannot cause injury. I am not asking you that which cannot be used to kill someone. So whatever answers you have given, say I'll start from him. You have told? Sponge. Okay. You give me a sponge ball. Okay. And I'll put the sponge ball inside your mouth, in your posterior pharyngeal wall. Will you survive or not? Then, बोलो. Next, तुम क्या बोले थे? कुछ नहीं बोले. इधर से कुछ एक बोला था? Yes? Paper. Same thing, paper can be used. पेपर तुम इतना सारा पेपर, बहुत सारा पेपर डालो, पेपर डाल के मुंह के अंदर डालो. कॉटन कैंडी, इट कैन कॉज इंजरीज. कैसे कॉज कर सकते हो बोलो? Then there is a balance in the nature. मैं अगर तुमको बोलूं कि I'll give you 1,000 cotton candies. Now, the same example is with oxygen. Oxygen you are taking, right? But now, if I bring an oxygen cylinder, तुमको mask दे दूं, and I'm giving you oxygen, तो लो 24 घंटा तुम oxygen लेते रहो mask में. So, excess of oxygen is also not good. It will cause pulmonary edema. Then I'm just giving you an example how it can cause. Different ways may be there. Cotton candy से भी. Same ice से भी होगा. Ice भी हो सकता है. Can you cause injury by ice? कैसे? Very good. It is known as snow icicles. It can be used as a dagger. कैसे फिर इसका वेपन कैसे रिकवर करेंगे पुलिस? तो अगर मैं किसी को आइसिकल से मार दूं, yes, frostbite. Okay, that is the role of forensic medicine. Okay, that अभी मार दिया, अभी हमको निकालना है कि what are those injuries and what could be the possible weapon. Then paper भी है, oxygen भी है. There is not a single thing which will come to your mind which cannot be used as a weapon. Anything you can use. Solid, liquid, gas. Okay. So in exam, weapons will not be limited to whatever was shown to you. Okay. I'm trying my best. When you go to third year, we'll collect as much as weapons we can. A weapon can be this one also. I can give you this pen and ask you that describe this weapon. How can you cause injuries by this weapon? I can give you this. I can give you one water bottle. So anything can be used as weapon, right? Now the point is that weapon, what injuries it can cause and how it can cause. That is your imagination. Like a cotton candy, it's a good example. But how cotton candy can cause the injury or can kill someone? हो सकता है. वही मतलब it's up to you how you imagine. You can definitely use. Then a person with diabetes, that person is taking insulin. You can easily kill that person. Give him more dose of insulin. Right? So it depends on the insulin is a medicine. There is a difference between poison and drug. Drug is used to save the life. When the same drug is used in excess or in less amount, that becomes a poison. Right? Now due to thermal injuries, it may be due to heat, burn injury, it may be due to cold, frostbite, okay, hypothermia. Due to chemical injuries, it may be due to acid, alkalis or corrosive salts. Due to physical agents, electricity, lightning, radiation. Can you kill someone using lightning? कैसे? बोलो. कौन मारेगा? तुम रखोगे उधर, तुम वेट करोगे लाइटनिंग का. Lightning is mostly accidental. You will not wait for the. How will you wait for the lightning? And in theory, we will take it more that bolo light. Yes, it can cause. तुम सोचो कैसे लाइट कर सकते हो? कर सकते हो कि नहीं? लाइट से भी कर सकते हो. लाइट का डिफरेंट वेवलेंथ होता है. Okay, wavelength. Whatever we are seeing, this is visible light. But electromagnetic waves में there are much more. Radiation है, X-rays है, वो सब है. But light से भी तुम कर सकते हो. तुम कौन से मूवी में था? Final Destination. Okay. We'll discuss about these things. These topics are there in my theory class. My theory slides. Okay. Now this is abrasion. Abrasion, I think most of you will have this injury in your life. Abrasion, सबको हुआ होगा. Abrasion. It is destruction of the superficial layer of the skin. Now in exam, if you write only this line, an injury involving destruction of the superficial layer of the skin, then you are half correct. Because superficial burn injury जब बोलेंगे हम लोग, burn injury का भी same है. First degree burn, that only the superficial layer is gone. But that is caused by heat. But abrasion is caused by blunt force. So don't forget to mention this mechanically by blunt force impact. So that is abrasion, right? Various types are there: scratch, graze, pressure, impact. We'll go into details in theory, but just for now, you remember the names and how does it look. Okay, scratch abrasion. This one, take a pen, pointed object, scratch karo. That is scratch abrasion. Use your nails. Okay, scratch karo. That is a scratch abrasion. Right? So it is caused by a pointed object. A knife. Knife का जो pointed object है, pointed part है, that can be used for abrasion. Right? This is known as grazed abrasion. Grazed. Okay? It is caused due to friction against a broad surface. Now suppose here, ये तो tiles है, इसमें थोड़ा मुश्किल है. Suppose a road and I drag someone. Okay? You are not coming to class, so I have dragged you to the class in this field. So you will have this type of injuries, grazed abrasion. Most common type of abrasion seen in anything which comes to your mind? Very good. Road traffic accident. These are all Viva questions. Okay, so now you know. Road traffic accident. What is this? This is also an abrasion, but the type here is, you see here, the duration of the force is more than the pressure of the force. The duration is more than the pressure of the force. This is an example of ligature mark. Someone has hanged himself or herself. So, the rope is creating one pressure on the neck. Because of this pressure, this is a force. The duration is more, but the pressure is less. Okay? So, a small pressure for a longer duration of time. That is known as pressure abrasion. Pressure abrasion. A small force for a longer period of time. That is an example of this ligature mark in hanging. Very important point. MCQ plus short note plus Viva question. Now there will be something. So here the duration is more, pressure is less. Now there will be something where the pressure is more, duration is less. Anything which comes to your mind? Yes? Execution. Mane? That is abrasion. You are coming to that point. Say accident. Rollover tire. Okay, body के ऊपर से टायर उठ गया. Something like this. This is an example of. This is known as impact abrasion. The previous one is pressure abrasion. This is impact abrasion. Here, the duration is less, but the impact is more. The pressure is more. Tire का pressure होता है. Okay, so that one has gone over the body for a short duration of time. So the duration is less, pressure is more. That is an example of impact abrasion. Similarly here also pressure is more, duration is less. This is that injury, this one. This is that abrasion. When we take firearm injury, that time I'll discuss about this point in details. But this is that impact abrasion caused by this surface. This surface. Okay? Now, whenever you see news, you will understand what do you mean by abrasion, right? And what are the types of abrasion. What is a bruise? Bruise is something, effusion or extravasation of blood into the tissues. Now this blood, if it is underneath the skin, why it is caused? Due to rupture of blood vessels by application of blunt force. Effusion of blood underneath the skin due to rupture of blood vessels by application of blunt force. I take a bamboo and I beat you. So there will be some swelling here, blue color discoloration. That is a bruise underneath the skin. This one. Now the same thing, if it is inside the body, that becomes a contusion. So bruise and contusion, these are same. Extravasation of fluid into the surrounding tissue. The only difference is that bruise we will call if it is underneath the skin. Contusion is if it is in this muscle, lungs, brain, spleen, mesentery, etc. in other tissues and organs. And why bruise occur? Due to rupture of blood vessels by blunt force. Accident case, what happens in RTA? Sudden break, then the person moves forward. ये जो steering होता है, that steering touches the chest. Okay, so here you will see bruise, but inside this one, you will see bruise outside, but inside it may contuse the heart. Contusion, contuse the heart. Okay, then either you may find contused brain. Right? So that is bruise and contusion. See, this is the contusion in the brain. This one. Contusion in the brain. This is contusion of the neck muscles because of some strangulation. Strangulation. Okay? What do you mean by strangulation? Hanging is different. That is manual strangulation. Yes. Palmar strangulation will be this, using palm if I choke someone. Okay, if I kill someone. So this is also an example of bruise. You see, extravasation of blood in the skin, right, underneath the skin. Now bruise, this comes as a short note. All these injuries, you have to find out the age. Okay, aging of a bruise. It helps us to find out what is that date. No photographs, no photo, no. It helps us to find out the age of the bruise. Now what is laceration? So abrasion is caused by sharp force or blunt force? Blunt force. Bruise is caused by sharp or blunt? Blunt. Laceration is the next injury. It is a tear or split of skin or mucous membrane or muscle or internal organs produced by application of blunt force to the body, which stretches the tissues beyond their limits. This is an example of laceration. Okay, forget this part. We'll discuss these things in theory. This is an example of laceration. In abrasion, they used to ask this question: which one is 3D, which one is 2D injuries. 2D injury means you have only length and breadth. That is abrasion and bruise. Next injuries, laceration, incised zone and stab wound. You have the length, breadth and depth. Okay. So here you see the skin is separated. In abrasion and bruise, skin is not separated. Here the skin is separated and it is irregular. That makes the difference between incised and laceration. So this is a lacerated wound. For now you just identify the injuries. Details we'll take in theory. What are the types of laceration? Tear, split, stretch, cut, avulsion. Tear means when the blunt force is applied in a body, in an area where there is sufficient amount of underlying fat. There you will have tear. Say for example, if I use a bamboo and I hit someone here, sufficient amount of fat is there. So here there is a chance of having tear laceration. Remember this line, having sufficient amount of underlying fat. The opposite is split, where minimum amount of underlying fat and muscle. Say for example here, head. You do not have much fat here, elbow, okay, knee joint. So there, if you hit someone with a bamboo, you will have split laceration and it looks like an incised wound with some differences. So it is known as incised looking lacerated wound. Short note in your exam. Do you know, now you understand the difference between tear and split? The difference is with the location. Here it occurs in an area where there is sufficient amount of fat underlying the skin, and here minimum amount of underlying fat and muscle. Next is stretch. Stretch is something you hit someone and there is tension in the skin and the skin is separated. That is known as stretch, overstretch. Okay, stretch laceration. This is cut laceration. You take a dao and maro, matepe. Okay, that is known as cut laceration. Here it is caused by heavy cutting weapon. Heavy cutting weapon. Here it may not be a cutting weapon. It may be a bamboo also, blunt. Okay, here this is also maybe a blunt. This is also blunt. Okay, but here heavy cutting weapon like chopper, axe, industrial or farm machinery with tremendous amount of force. So that is the difference between this one and the remaining three. It is cutting, heavy cutting. Avulsion means that the upper wala skin chala gaya. That is avulsed. And caused by grinding compression of a heavy weight applied at an acute angle. You must have seen in movies or in Google, like when there is an accident, one of the limb is gone, or one of the from one of the part of this leg or hand, the entire skin is gone. That is known as avulsed laceration. Any confusion till now? Where?
Finger is stuck in the hinge of the door. It will come in.
Fingers stuck in. Isme? Yes, avulsion. If the overlying skin is gone, that will become an avulsion. But if the skin is intact, then it becomes a stretch laceration. Here the skin is intact. Right? Here the skin is gone. Okay. Incised wound, you all know about this. You take a blade, give an incision, that is known as an incised wound. Okay, clean cut. wound through the tissues caused by sharp-edged instrument, object, or weapon. Now, these three terms, surgeon, butcher, and carpenter. These are the three mechanisms by which an incised wound can be caused. Surgeon, you have seen how we give the incision, like this. Okay, like this. This is a surgeon's incision. It is like a drawing. This one. Butcher. This one. Butcher. This. Surgeon is this one, like a painter. Butcher is striking, and carpenter is sawing. Okay. This one, this one, this one. Sawing. Now, suppose I want to kill someone. I have a knife. सामने लिया किसी को. Then this one. This one is sawing. Okay. Now this one. Suppose this is the neck I am holding like this. I have done striking. Okay. I had a case like this. Husband was divorced. He wanted to come back to their life to take revenge from the wife. उसने क्या किया, मतलब he used to go out for roaming with the children. He had 2 children. एक दिन दारू पिया, पीने के बाद he wanted to take revenge from his wife because she didn't come back to him. तो जंगल में लेके गया, गले को ऐसे पकड़ा, ऐसे काटा. Okay, so that is striking. This is just one strike. This is drawing. Another one is sawing. Okay. Now this striking, if it is perpendicular, this is the neck, or this is the, suppose this is the hand, I take it down, perpendicular, that becomes a chop wound. Okay, that becomes a chop wound. If it is at an oblique angle, there is beveling. You don't have to remember this for now. You remember that perpendicular direction, it creates a chop wound. This one, incised wound. Can you get the idea of the direction? कहाँ से कहाँ हुआ? Is it from here to here or here to here? Here to here. Okay, incised wound, one beautiful thing is this tailing. It helps us to get the direction. Okay, it gives us, like here you can get an idea that it starts from here to here. Okay, this is known as the tailing of wounds. Stab. A deep wound produced by the pointed or piercing end of a weapon or object entering the body. Stab wound. Here, these are all stab wound. Okay, these are all stab wound. This one is known as punctured wound. Needle injection. Punctured. This is penetrating wound. It has gone into the cavities. Through and through. Perforating. Okay, I might give you this as spotter. Which one is punctured, which one is penetrating, which one is through and through, perforating. Now this one, more details we'll get into theory. Remember that it may have sharp edge, rounded edge, single edge, double edge, will cause different shape. Single edge will cause this type of shape of the stab wound, double edge will cause this type of stab wound. Single edge, double edge of what? The weapon. Okay. Which part of this weapon has caused this one? This one. This is called what? Hilt. This is known as the hilt. Because of this hilt, this part is caused. This one. It's an abrasion. And this weapon has to be fully inserted to the body. Then only, say this one you are using to stab me. Okay? And पूरा जोर से स्टैप किया, करने के बाद at one point this one will be striking my this skin. Because of this hilt, this one is caused, and because of this one and this one, this surface, this edge, this one is caused. Okay. Now, if one side is blunt and one side is sharp, that is known as single edge. If both sides are sharp, this is known as double edge. So accordingly, as I told, if it is single edge, this shape will be caused. If it is double edge, this shape will be caused. Clear? Okay. Something like this: single edge, double edge. Now you tell me, what is this injury? Which type of abrasion? Grazed abrasion. Okay, very good. This is what? Yes? Louder? And you are telling incised. Why ligature mark? Rope से strangle heart. Rope से you cannot strangulate. हाथ में कैसे strangulation करोगे? I understand strangulation chapter अभी तक नहीं हुआ है. When we go into strangulation, that time we will know in details. This is basically suicidal wound, multiple incised wounds. Okay, multiple incised wound, and she committed suicide. What about this? This is not the upper one. This one. This one. You tell me. What is this? Yes. Bruise, contused abrasion or bruised abrasion. Okay, or abraded bruise, you can say. Okay, these are some terms. Which one is abraded bruise, which is contused abrasion, which is abraded contusion. Why I am saying? Because it has elements of contusion as well as abrasion. Okay, this is abrasion. Here you see some discoloration. This one, right? So bruise and abrasion both. This is what? Laceration. Lacerated wound, but which type of laceration? Avulsion. Okay? इधर देखो सब. This is avulsion. You start saying laceration. Do not jump into avulsion first. Then let the examiner ask you that which type of laceration. Then you say avulsion. Okay? This one. This is what? This part. This is the sternum, right? And it is inside the sternum. So that becomes what? Contusion. That is contusion in the sternum. Okay? What is this? Which type of injury? Ligature. Very good. When we start hanging asphyxia chapter, there we will know in detail whether this is a ligature of a hanging or a strangulation. Okay, but for now, no. Abhi mat bolo. And you are wrong. For now, you remember which type of injury? Ligature is what? Which type of injury? Abrasion. Which type of abrasion? Pressure abrasion. Okay? Pressure abrasion. होगा वेट करो थोड़ा. एस्फेक्शिया में हम लोग करेंगे चैप्टर डिस्कस. What about this? Abrasion, grazed abrasion. What about this? Okay, this is one line, this is one line. In the middle there is a gap. This is one line, this is one line. In the middle there is a gap. It gives us an idea of the weapon. क्या weapon हो सकता है? कैसे मारा इसको? Rod. Almost same. Rod नहीं, bamboo. Okay, bamboo. Bamboo से continuously मारता रहा. We will not comment whether it is a bamboo or a rod. We will say a blunt object. Okay, moderately heavy blunt object. Same tram line or train track same है. Okay, So multiple injuries were there. These are all known as tramline bruise or railway track bruise. This is what? This one? This is a scar. Scar. Medical legal importance of scar marks. Last time I had. Okay? Scar marks. This is what? This is a bruise. Okay? It was a case of child abuse. And I was called to Arunachal for this. This one is what? Why laceration? For now it will be difficult. Laceration and incised ka one main differences will be the margins. Okay? Incised zone mein the margins will be clean, and in laceration the margins will be irregular. In laceration you will see some tissues which will be connected to one another. In incised it is clean cut. You will not see any tissues. This is an example of incised. Okay? Incised. Do you see the tailing? You see the tailing here? So, udhar se udhar. Which one? This one. This one. This one. When you see, compare with the laceration, I'll show you. For now it is still a new thing. I'll show you the margins of laceration. That times it will be clear. Okay, this is comparatively clean margins. This one. We all have seen this movie. What type of injuries will be caused? What are the injuries? Tell me in overall in details. Abrasion, can this cause abrasion? Yes, why not? Abrasion हो सकता है. Bruise? हो सकता है. Bruise. Then, which will be the most common type of injury? Striking. क्या है उसका नाम? Chop wound. Okay. What about this? Sawing. Which type of injury? Sawing मतलब which type of injury? Incised wound. Right? Perforation. Very good. Which type of injury? Perforation. Stab wound. You will see many news like this. You will get, when you work in hospitals, you will get injury cases. Now you know what do you mean by chop wound. Now you know sharp cutting weapon, what injury it can cause. Now you know cuts bodies into pieces. It means what? Minor kids throat slit. It means what? Incised. Now body with bruises found stuffed inside iron truck. Now you know what is bruise, right? Okay. I don't know whether you have seen this clip or not. Here, this person was enjoying in Holi, and he had a knife in his hand. Okay, and he was so happy. He started to stab himself while dancing. Okay, and then ultimately he died. As far as I remember, he had 22 stab wounds on himself. Now you see this. Okay, firearm injury. This is a very complicated chapter. I don't want you to confuse. For now, you remember the injury and the cartridge. How does the cartridge look? Which one is rifle, which one is shotgun? That's all. You have seen this movie? KGF. What does this mean? Kalashnikov Singh. क्या नाम है? AK का full form क्या है? Kalashnikov. A stands for? And 47 means what? AK-47 means Find out by yourself. What do you mean by AK-47? Okay. Now firearm injuries. All these firearm injuries. Hello. Firearm injuries. All are medical legal cases. Okay. Any injury case will be a medical legal case, and you have to know about the firearm injuries. These are the parts. I'll not go into detail. This is the butt of the stock. This is the body, okay, or the action, and this is the barrel. Okay. This is the muzzle end. All these things. Classification. There are various types of classification. This is of a rifled firearm. This is of a smooth bore firearm. This is shotgun, and this is rifled. You know the difference. This is the barrel. Okay. There are some irregular structures which makes the bullet, when you fire, makes the bullet rotate, spin. Okay. This rifling helps the bullet to spin. What is the importance of this spinning of the bullet? Velocity. Increases the velocity and also helps in the piercing. Okay. And this is for shotgun. Okay. Barrel. Another difference will be, say, rifle, shotgun, pistol. This is the way you shoot. There also one classification is there. This is on the basis of the barrel, single barrel, double barrel. Okay, there are different types of guns. This is on the basis of the rifling mechanism. Rifling mechanism, brake action, lever action, bolt action, pump action, and semi-automatic action. You will not know this by now. Okay, it's there in the book. In theory, we'll discuss more. This one is which one? Bolt action. And this one is pump action. Any example of semi-automatic gun? AK-47. What do you mean by semi-automatic? I have a video, I'll show you.
Sir, automatic balance.
Automatic matlab? Semi-automatic means what? You pull the trigger, one bullet comes out, you again have to pull the trigger, another bullet will come out. That is semi-automatic. Automatic means pull the trigger, machine gun. Automatic, the bullet will come out. But here, you pull the trigger, bullet will come out, you again have to prepare the gun. This one. You see, you again have to prepare the gun. This is known as the cocking of the gun. This one also, you have to prepare the gun again and then pull the trigger and then it will come. The bullet will come. Okay? So ballistics is basically the study of motion of the projectile. It has three parts: proximal, external and terminal. Proximal is whatever is happening inside the gun. That is proximal. External means not inside the gun. What is the feature of the bullet after coming out of the gun before striking the object? That is external. Terminal is the examination of the bullet after it strikes the object. We are dealing with this. Being a doctor, we are dealing with wound ballistics. We are not dealing with these two. This one. Okay. So whatever is happening inside, that is known as, yes? Initial नहीं है, और एक नाम था. क्या बोला था मैंने? Yes? And whatever is happening to the bullet in the air, that is different. And when it strikes the object, this is terminal ballistics, wound ballistics. Okay? We are dealing with this, wound ballistics. Okay? To make it simple, this is interior ballistics, exterior ballistics, terminal ballistics. So being a doctor, we will examine whatever is happening with the body, we will examine the injuries, we will examine the we'll take out the bullet if it is there inside the body. So you should know how to examine the injuries. You should know how to take out the bullet, how to preserve the bullet, how to hand over the bullet. Remaining things will be done by ballistics expert. So what is your role as a doctor? to examine the injury, firearm injury, to find out whether this is shotgun or rifled. And what is the distance, probable distance. Suppose he is shooting me from there. I'll have some features in my body. She is shooting me from there. I'll have some different features. What is that feature? Angle. The angle will be different. Someone is shooting me from there. The angle will be different. So entry and exit wound, the direction, the distance at which the firing is done. All these things you have to examine. If you find the bullet, how will you take out the bullet? How will you hand over to the police those bullets? That is your role. So you just remember, for now, this is bullet. This is ammunition of a rifled firearm. This is of shotgun. Okay, that is the main objective. I'll bring samples for you from police. We'll see. This is for rifle. This is for shotgun. Accordingly, we will examine the injuries and find out the range. This is the range. Okay, how we will find out. This was one case. These are pellets. Bullet is called for rifled, and for shotgun it is known as pellets. Okay. And this is burn injury. That is completely burn injury. This is scald injury. This is hot air, hot heat. This is liquid. You throw warm water or warm milk on a body, it will be like this. You have seen this movie, Chapa? Vitriolage, not seen. It is based on acid throwing. So that's all for today. You remember this one. We'll take into details in theory. This, which one is shotgun? This one, and this one is for rifle. Quickly, I'll show you the parts. What are the parts? Yes. Okay. You see this one. Details will go into theory. This is known as a firing pin. Okay, this is the firing pin. This is the cartridge with the bullet. Okay, now when you pull the trigger, you cock the gun. Cock the gun means prepare the gun already. Okay, pull the trigger, then the firing pin will touch the cartridge. Now the cartridge has different parts. This is the shell, and that thing is shell. This is the bullet. This is the primer. This is known as the primer. This is the gunpowder. What are the types of gunpowder? We'll go into theory. Okay, these are the primer. So the firing pin will strike the primer. Okay, now the primer will have the primer compound. Okay, what are those compounds? Primer compound. Foil paper, Avil. What is the purpose of foil paper? This helps us. This is when it is made. The gun, when this structure is made, this is usually wet. Okay, this foil paper allows, it prevents the spread of this primer compound into the surrounding structures. This is the purpose of this foil paper. This Avil, you see, it is pointed this side. So when the firing pin strikes, okay, so it is something like this, right? When the firing pin strikes, there will be pressure in the firing this primer compound. When it is pointed in this direction, this creates a spark in the primer compound. See this spark. This spark is produced here. Okay, and this is caused because of the structure of that Avil, because it is pointed at that side. something like this. Suppose this is the primer compound, this is the firing pin, this is the firing pin, this is the primer compound, this is the avil. So इधर से फायरिंग पिन पुश कर रहा है, इधर से एविल का जो पॉइंटेड एंड है वो इधर से पुश कर रहा है. So it creates a pressure on this primer compound. So there is a spark. This spark is released into the gunpowder. Now when gunpowder is ignited, आग जलता है, pressure is created. Because of this pressure, the bullet comes out. The bullet will come out. Now you see, bullet तो चला गया. Now you see a small portion of the gas. This is the gas. Is going back. Okay, is going back. What is the purpose of this? You see, because of this, one cartridge comes out. The next cartridge will automatically load. So it is an example of which one? Semi-automatic. Very good. Semi-automatic. The pressure, the force which is used for the propellant, some amount of that pressure or the force will be utilized to load the next cartridge. You pull the trigger again. Now the second cartridge will go and it will come out. Like this. Clear? Automatic में क्या होगा? You don't have to pull the trigger again. You pull the trigger once and automatically bullet माने ऐसे आता रहेगा. Machine gun. Okay? Now in shotgun, this is the last video. Shotgun, what happens? Here, these are all cocking of the gun. It is getting prepared. Okay, almost the same mechanism. This is the firing. We have pulled the trigger. Now. This is the firing pin. It will strike the primer, right? But here the composition is different of the cartridge. This is the primer. This is the primer. This is the gunpowder. This is known as the wad. And these are the shots. These are the pellets. Okay, now primer itself is a short note. Another short note, or they used to ask what is the function of this wad. The composition is almost same of the primer. See, primer compound, pepper disc, avil, same thing. Combustion hoga, pressure will be generated. See, this is getting now pressed. Here we have the pellet. Now what is the function of this wad? Pehla wala tha bullet. These are balls. So if this place is not there, this one is not there, just imagine all the gas which will be formed. This will be released through the balls. Idhar se aa jayega. So there will be no force for this to come out, because there are certain gaps, and this gas will be coming out of these gaps. To prevent this is a plastic structure which is kept in the middle, so that whatever gases are formed here, it doesn't leak. Okay, so it will push the pellet. It will push the pellet. Pellets will go, and this wad will fall down. We will see these wads in the crime scene. This wad in shotgun. Okay. Okay. So that's all for today.